My name's Linda Pillow. I'm the Director of Physical Therapy at Graves Gilbert Clinic. We are excited to announce that we're going to be opening a balance and dizziness clinic soon. We will be performing free evaluations for patients in the beginning. We'll be checking them for any problems associated with balance and dizziness. The four main things that come to mind for balance and dizziness are generally issues with the inner ear, which is dizziness, vertigo, sometimes it's called BPPV, and we treat that and get great results with the Epley maneuver. We also treat patients that have developed weakness in their lower extremities and their trunk that could be from inactivity or a stroke, and we can help them with their balance issues with a specific exercise program. We also work with patients with sensory deficits in their lower extremities, such as peripheral neuropathy.
We have another machine called the Biodex. We use it a lot for balance, and it's for people of all ages. We also can use it for proprioception training on our young athletes, such as after an ACL repair. It is a machine that has a stable base that we can adjust until it's extremely unstable, with varying degrees of games and different activities they can do on that. And there's also a printout record of that, so the patient can also track their progress along with the therapist.
Generally, our goals for this program would be to help patients get back to their joy of living, to decrease their fear of falling, and to decrease falls.
The most common reason that people have dizziness is something called BPPV, benign paroxysmal positional vertigo. All of our PTs and PTAs are trained to treat this. For 95% of people, the Epley maneuver is going to be the most effective. But it is something that is usually very easily fixed, doesn't require surgery, doesn't require any medication. So we're very excited to offer that coming soon.